because I'm always excited to have her join. It is none other than the CEO of Sinai Hospitals, who led us all through COVID, whether we spoke English or Spanish. She's just that person, and we're happy to have her join us this morning. It's none other than Dr. Ngozi Ezike. Dr. Ezike, welcome back to WVON.
Thank you so much. Compliments of this season, even in the midst of some of these really awful events. I'm still wishing the best for you and yours during this season and into the new year.
And same to you, particularly with the work that you do, because you care for so many, and that's kind of been your life's work. Wonderful to have met your mom, and just you just make me smile every time I get to talk to you. So it's good to have you here this morning.
Thank you.
Let's talk about interestingly enough, Dr. Ezike, and I'll tell you, this morning's show is going to be a lot about hospitals, because I'm talking with you about safety net hospitals. After I'm talking to a ProPublica reporter about a small town in Georgia with a big hospital where black folks still aren't being treated well. And then later today, Nick Blumberg from WTTW is going to come in and talk with Cleopatra about some issues out at Rosen Hospital. So we got this whole thing covered, I think, today, but I'm happy to have you kick it all off because, you're the one. So so let's talk about this, because you run the Sinai system, and for so many and in so many cases, it is a safety net hospital. Talk to us about that. What is a safety net hospital?
Yeah, I think so many people don't even know, so thank you for the opportunity. Safety net hospitals are this important anchor, like a literal anchor for the entire healthcare ecosystem, because while there are nice, fancy hospitals that really do some of the top-level care for innovation and, just doing transplants, you have these community hospitals, these safety net hospitals that are taking care of patients that some of these hospitals don't really take care of because of Medicaid insurance or not having insurance at all. But yet we know that healthcare is something that the entire community needs. And so if we don't take care of the poorer communities and the vulnerable people, the areas that already have the highest rates of disease and lowest life expectancy rates, those gaps are going to even grow. So safety nets are taking care of the people that others won't, and making sure that everyone understands that healthcare actually is a right for everyone and not just a privilege for a few.
So when you think about safety net hospitals, and we see hospitals as we drive through the city or drive through the country, how many would you imagine are considered safety net hospitals? Yeah,
so only about 5% of all hospitals in the United States, are considered safety nets by virtue of the large amounts of Medicaid-covered patients that they serve. But, of course, it's that small but mighty group, that 5%, that provides, 28-30% of all the charity or free care in this country. So for those who need care that can't get it in other places, the safety nets are the ones that are there for them.
So when we start to think about people who are poor, who are uninsured, who are underinsured, who are on Medicare, most 28% of those people are going to only 5% of these hospitals, these safety net hospitals.
That's right. That's right.
Which, I would ask you why they matter, but it just seems so obvious. But when we start to think about these hospitals, do they provide the same kind of services as we think about when we think about the major hospitals?
These hospitals are incredible. There's a phrase, they say doing more with less. Like safety net hospitals like Sinai Chicago are taking that to the nth degree. We obviously are taking incredible care of our patients in a very special way because we welcome patients, of different hues. We welcome the patients, that don't have, the gold star insurance. And so there's a special kind of dignity and compassion that we give that our patients feel. But are there differences? Yes, because of the lower reimbursement that we face, we often will have, equipment that's not as updated. We are trying to do more with less, so we might have leaner staffing because, we're trying to make sure we can spend every dollar. So our employees, we're really working them. But incredible care, Sinai has a trauma center world-renowned that we know the number of lives that are saved. We know the high survival rate that we have. So we're doing incredible work, even in the toughest of circumstances.
Well, and certainly given the kinds of situations you deal with, you have very well-trained doctors, whether they're trained before they get there, trained on the spot. They clearly know what they're doing. You mentioned something about lower reimbursements. Talk about what that is, where the reimbursements come from, and why yours are not full.
See, when a patient comes to the door, whether it's through the ER or however, a lot of places will do what I like to term a wallet biopsy, where they're basically trying to suss out, like, what kind of insurance do you have and how much are we going to get reimbursed, and then kind of determine, what they're going to do for you based on what they're going to get. Because we know that Medicaid does not reimburse for the same care at the same level that someone with, their private insurance, maybe their employer-based insurance, their HMO, their PPO. And so if you're going to give the same care but get so much less money, that puts you in a difficult situation every month when you're trying to pay the bills because you got less despite giving that same, life-saving, life-promoting care.
But in those same vein, you're giving everything that anybody needs. You're covering primary care, you're covering emergency care, certainly behavioral health, maternal care, and trauma services.
Everything. We provide everything, and we're proud to do it. But it's getting more and more difficult. We are bracing ourselves for some of the ACA subsidies that are supposed to go away at the end in 2 weeks, unless something changes. And so as ACA subsidies go away, that means that people who are on the Affordable Care Act might just not have insurance anymore. That means fewer people that are insured. They're probably still going to come to our doors. And so that means we will get even less reimbursement, which, again, really puts a strain on this incredible mission of trying to serve everyone regardless of their ability to pay.
I want to ask you what keeps you up at night, but I just heard what keeps you up at night. When we get to the end of the year, then you will just have to, how do you manage in a situation where you don't have the things that you need or don't see those things coming? There's this safety net seems to be gone if they don't do something about these subsidies. Any
leader, at a safety net has to be thinking very creatively, trying to be as agile, as nimble as possible, trying to identify other resources. I'm looking for new and deep partnerships with different kinds of partners, not just our typical healthcare partners, but looking to the corporate world to figure out what are the opportunities there for corporations that do business in Chicago to support this incredible work, because we are trying to keep healthy their workforce. We're looking to the philanthropic world to see how can they support this incredible work. So really looking for new partnerships, really trying to double down on being as efficient as possible so that we're saving every dime, making sure we recoup every dollar. We're trying to do all this because we don't want to have to cut back services. We don't want to say that our community should have access to less. That's not the direction we want to go. But at the end of the day, we have to find the resources to keep this critical work going.
Dr. Ezike, you mentioned that wallet biopsy, and I think about going into an emergency room and being asked while somebody is bleeding on the floor about their insurance, being asked about these other things, which are all about the business of how they're going to get paid for it. But the thought would have always been that you should take care of these people who come into the hospital because they only come in there because they have to be there. That's what you experience at Sinai and at the safety net hospitals, but it's not what happens at all places, which makes you that much more critical to the process. What are you hearing from corporations? What are you hearing from others as we move up as the net gets frayed, as things begin to come to a difficult case for you?
Yeah, I'm sitting down with leaders from all different sectors, and the will is always there. People, once you hear about the work that places like Sinai, Chicago, the work that we do, it's a no-brainer that this is a good thing. You are, I often hear you're doing God's work, and so now it's just finding a way to let those leaders be a part of it, and it can look in different ways. Sometimes it's going to be, outright donations. Sometimes it will be equipment. We need laptops. We need office furniture. We need IT. We have IT needs. So really thinking creatively about all the different ways that people can support. That's the opportunity that we have, and that's what we're presenting to our partners in the city of Chicago.
Dr. Ezike, I mentioned at the top that you were the one who truly led us through this COVID pandemic, and we loved and felt comforted with all that you gave us. When you decided to leave the Illinois Department of Public Health, you could have pretty much gone anywhere. Why did you go into a situation as difficult as this one at Sinai Hospitals and Safety Net Hospitals?
When you have been given much, then you also have to give back much. And I feel a very strong calling to serve, to whom much is given, much is expected. And so I am honored to take on some of these challenging roles that have such incredible impact and that mean so much and that take care of those who are often forgotten. I'm excited to be an equity champion in a world where equity has become a four-letter word. I don't believe it's a four-letter word. I think it's something that we have a calling to do, and I'm grateful for the opportunity to play my part.
And we're so grateful to have you there doing just that. Dr. Ezike, what happens now, and then what's expected to happen if, in fact, things continue along the ways in which they are for Sinai hospitals and other safety net hospitals like yours? I'd imagine that most people are coming there probably through the emergency room now, but what would be expected going forward?
We have been around for 106 years, and there is something, I guess, like staying power that's in the walls, that's in the water, and so we're confident that will continue, but it's not going to be an easy ride. There are a lot of headwinds, but I also feel that the work that we're doing is something that everyone can get behind, and we have a lot of resources. We have a lot of resources in the city of Chicago, and so I think as we really think about how we use those resources, how we galvanize to support communities that have been for decades and decades disinvested, I think it becomes not a hard decision to make the appropriate investments in the healthcare of these communities, and that means supporting institutions like Sinai Chicago.
Indeed. What is it, as people are listening here and people are listening from all different quarters, what is it that we all should be doing to help elevate the message that you're sharing and, importantly, elevate the needs that are there to ensure that they get fulfilled in the future?
I think everyone should educate themselves on what safety net hospitals are and what they do. Safety net hospitals, as I really tried to describe in a TEDx Arlington Heights talk that I just recently delivered, that was recently published, safety net hospitals are essential infrastructure, and our healthcare ecosystem, the entire healthcare ecosystem, no matter where you go, it's affected by what happens to the safety net hospitals. And so the health of this safety net hospital system is going to affect everyone's health, because in the unspeakable, reality of, safety net closing, that means that those patients will now come to the remaining hospitals, and that means longer wait times to get the care that you need, because now, you have more people accessing that hospital. That means that, in your time of emergency, maybe the closest hospital that you would have gone to get that emergency care won't be there. And now you'll have to spend a few more minutes, to go to another hospital. And we know in the case of emergency, minutes equals life. So all of us are interconnected. And so people understanding exactly what a safety net is and how important it is to each individual, even if you don't go to one, that's what's going to make the difference so that people can make the right choices, can advocate for the right legislation that will protect people with Medicaid and protect the institutions that serve them.
Sounds like you just told us what happens to the least of us happens to all of us, and we need to take care of them.
Thank you. Exactly. The strength of our healthcare system isn't about the fancy towers that we build. It's the people that we are ensuring that we catch.
Wonderful place to leave it. Dr. Ngozi Ezike, always a pleasure to talk to you. Stay strong in the fight. We're fighting with you because we need you.
Thank you so much.
Be well.